For you to click this video, I know you really want to know about ectopic pregnancy. I got a question as usual from one of my subscribers. She was recently diagnosed of ectopic pregnancy and she had to undergo an operation. She was really down. So that is why I'm out here to make the video on ectopic pregnancy. So I enlighten her and also enlighten my fellow subscribers, about ectopic pregnancy. Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today we're going to be talking about ectopic pregnancy. What are the causes, who are at risk of going down with ectopic pregnancy, and also I'm going to be telling you if an ectopic pregnancy can survive it or not. But before we go into details in today's class, please, if you are new on our YouTube channel, please click on the subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today I'm going to be talking about ectopic pregnancy. What is ectopic pregnancy? Ectopic pregnancy is a complication of pregnancy in which the fertilized egg is not in the womb. The fertilized egg did not get to the womb, it did not get to the uterus, it's not there, but rather is either in the fallopian tube, somewhere else entirely. But the one that is common is when the fertilized egg remains in the fallopian tube. To make you understand better, let me explain further. You know, when the sperm comes, it goes to the ampulla of the fallopian tube. It meets the egg. The fertilization takes place there. And the fertilized egg travels to the uterus. When that fertilized egg gets to the uterus, it implants and the baby gets the necessary nutrients, the necessary support it needs in that uterus, in that womb. But in ectopic pregnancy, that fertilized egg is not going to the womb, is not going to the uterus. That fertilized egg either remains in the fallopian tube or somewhere else entirely that it ought not to be. So generally, you know that fertilized egg is expecting nutrients, is expecting support it needs. But the fallopian tube cannot give that fertilized egg the support it needs. The fallopian tube cannot stretch. The fallopian tube cannot provide that nutrients. So the baby cannot survive there. So what happened? If not noticed on time, it might lead to the rupture of the fallopian tube and it can lead to bleeding. So in simple terms, just know that ectopic pregnancy is a fertilized egg that is not inside the womb. A fertilized egg that is not inside the uterus but is outside. But the one, like I earlier said, that is more common is the one that develops in the fallopian tube. So the next question is, who are at risk of going down with ectopic pregnancy? First one is, if you have had a history of ectopic pregnancy, you've had ectopic pregnancy before, you are at risk of having another ectopic pregnancy. So whenever you notice you are pregnant as a woman that has history of ectopic pregnancy, it is advisable you do a transvaginal scan at that early age to know if that fertilized egg is in the right position. Then the second one is, if you have history of pelvic inflammatory disease. If you have had history of pelvic inflammatory disease, that can leave a scar that might make that fertilized egg, that might make it difficult for that fertilized egg to get to the womb or the uterus. So having a history of PID, when you notice you are pregnant, see a doctor, and I will advise that you do a transvaginal scan to know if that fertilized egg is in place. Then the third risk factor is if you have had surgery in the fallopian tube. For example, you had previous ectopic pregnancy, one fallopian tube was removed or it was repaired. If you have had any surgery in the fallopian tube, you are also at risk of getting ectopic pregnancy. So I advise you see a doctor whenever you are pregnant and do a transvaginal scan. Then another risk is if you have history of infertility, you've been trying to give birth, you have only been unable to give birth, history of infertility, you can also see a doctor and also do one or two things when you notice you are pregnant. Then another is endometriosis. Endometriosis can put you at risk of going down with ectopic. STI, sexually transmitted infection, if you're always getting it or you have it, that might put the baby at risk of staying in the fallopian tube. Then also IUD, intrauterine device, which is a method of contraceptive that is inserted, that might put you at risk of getting ectopic pregnancy. And also, if you have a history of smoking, if you have been smoking, that might also put you at risk of getting ectopic pregnancy. A disclaimer, I am not saying that if you have all this, you are going to get ectopic pregnancy. I'm only saying these that I've listed, they have higher chances, they're at risk of going down with what? Ectopic pregnancy. Then that takes us to the signs and symptoms of ectopic pregnancy. In terms of the signs and symptoms of ectopic pregnancy, you are still going to be experiencing the various signs and symptoms you experience when you are pregnant. Tiredness, nausea, vomiting, positive pregnancy test. You are going to see that because it's a pregnancy that has taken place. So you are going to see, oh, I'm positive. You did a pregnancy test, you are positive. So these are going to show your normal signs and symptoms. They are going to show. Then also you might have what? Vaginal bleeding. There might be pain and there might be dizziness. In worst scenario, that's when the fallopian tube rupture. You know, the baby cannot stay there to be expanding. So when it's rupture, it can lead to complications. This individual will start bleeding, having vaginal bleeding. Most times, this person might have dark bleeding, dark blood coming out from the vagina. That might indicate what? Ectopic pregnancy. This individual will start having low blood pressure, feeling fainty, feeling pains in the shoulders. These are the signs that, oh, there could be something wrong with the pregnancy and you should see the doctor as soon as possible. So if you already have those risk factors, like I earlier said, my personal advice is, when you notice you are pregnant, see a doctor, do a transvaginal scan to ensure that the baby is in place and not out of place. Because if it's out of place, you'll be able to take medications to actually prevent surgery. You get, if it's detected on time, you're able to take medications and it helps you prevent that surgery. Other factors, other ways in which your doctor can diagnose, okay, it's ectopic pregnancy. They can do a urine test, a blood test, and also a scan can show the position of the ectopic pregnancy, where the baby is sitting. Is it in the left fallopian tube? Is it on the right fallopian tube? Is it outside the fallopian tube? So a scan will tell you, okay, where the ectopic, where the bleeding is likely coming from. In terms of the treatment, there's what we call methotrexate. Methotrexate will help shrink that growth that's already there, to help to stop the growth, to help to remove the growth. Then if methotrexate cannot solve it, your doctor might prescribe or tell you that the next available option is surgery. Then once you sign your consent, you give the consent, you give them the go-ahead, they can begin the surgery as soon as they can. For those asking if ectopic pregnancy can prevent a future pregnancy from happening, it doesn't prevent, except both fallopian tube were removed. If just one fallopian tube was affected, you can still get pregnant. Yes, that's what I'm trying to say. Yes, you can still get pregnant. Ectopic pregnancy does not automatically make you barren. It doesn't automatically stop you from getting children. When you have left or right fallopian tube ectopic pregnancy, you still have your fallopian tube, you can still get pregnant. But in all, always consult your doctor for useful guidance. Mine here is just to educate you and give you a general knowledge of what it is. You cannot prevent ectopic pregnancy. It happens. It's not within your power. But you can prevent STIs. You can prevent pelvic inflammatory disease from happening. Thank you very much for staying tuned. Thank you very much for watching our video on ectopic pregnancy. Don't forget to like. Don't forget to subscribe. And also don't forget to share with a friend if you got to follow. For all my returning subscribers, this is Nurse Mary saying thank you. Bye and see you in our next video.